My name is Mindy Pierce. I'm the nurse navigator for Memorial Breast Imaging, and I've been here for 5 years.
My name is Michael Scott. I've been here for 15 years, warehouse operations supervisor for Memorial Home Services.
I'm Joanne Hannick. I've been with the health system now for 40 years.
My name is Lonnie Norell. I'm an RN in the emergency room, being honored for 10 years of service at Memorial.
My morning, typically, when I come in the door, I've got about 9 guys that are back in the back and loading their vehicles in the warehouse, and start by greeting them and trying to help them get loaded and prepared for the day.
Hit the snooze button a couple times. Then my normal work day is, normally I have to pick the 6-year-old up out of the bed to move them to get out of bed. Then I get up, I shower, and I come to work. I look at my assignment for the day.
I live in Nokomis, so that's quite a drive for me every morning. The alarm goes off bright and early. I'm up and rolling. My whole house is asleep still, thankfully. I've got my husband and 3 children at home, so I'm able to get ready in the quiet house.
I try and start my day with either a walk or a little run in the park, and I kind of collect my thoughts, plan things, and of course the plans never come about the way you think they should. But then, so I get in here, and I think one of the things I like most is that there is no normal day.
When I get here, I immediately go to my computer and check all the pathology that is due to be coming back, because waiting is the hardest part. So I really try to get the pathology results as soon as possible and get the patients called as soon as I can. So that's my first stop, is check and path, see if anything came back while I was off of work. After I leave, if anything comes back late, so let's get this going. And if they're good results, benign results, I get on the phone and call.
What I like is you'll come in the emergency department, you don't know what you're going to be doing and what kind of patients you'll have, because we have different availabilities of jobs to do here, from triage to charge nurse to just taking care of patients on the floor. We have an ED2, which is less acuity, and we have RCE, which is an extension of the triage system. So you don't know what job you're going to have, so you can be doing something new every day you come in.
Of course, there's some really some stories that really pull at you and are tough to get through, but I'm a survivor. I was diagnosed with breast cancer when I was 30. So I've been there. I've walked the walk. I've been through almost every aspect of breast cancer, aside from distant metastatic disease. So I was lucky enough not to have any distant spread, but chemotherapy, radiation, surgery after surgery after surgery, I've been there. So I get it. I get the fear, I get the nervousness, I get the waiting's so hard. So I can share that with them, and I think it would help. I hope it helps them to know that, hey, she's done this, she's been here, she knows how I feel.
Usually we set up, we get ready for clinic, and we've got 8 nurses working throughout A Street and Jacksonville and Children's Center. And so we see a number of patients and work with a number of physicians. We have 1 full-time physician and about 5 or 6 part-time between the Child Center and here. So we run clinics all day long. We take messages. We help with walk-ins that may be in crisis.
Knowing that we provide a service that is not only wanted but needed. A lot of times we deal with patients that are end of life, and you want to make those last days, last minutes, last hours the best that you possibly can. And taking in things that will make that easier for them and the family is important.
I feel like I'm home here. I started my career at Memorial when I was just out of school many years ago, and have since gone to Taylorville Memorial and then the long-term care facility. But then coming back here, I felt like I was coming back home again.
I have, bar none, the best staff that I could ever ask for. Everybody that I work with works great together. They're a great team. I've never been in a position before where I've felt more like a family, so to speak. It's just a great group of people that I work with, and just the rewarding fact of knowing that we're helping people, that we're taking care of the patients, and that in itself is rewarding enough for me.
Every unit has to work as a team. And you see that throughout the hospital, throughout the outpatient settings or whatever. I think in psychiatry it's particularly important because the team, the people, they are our tools. That's what we do to help people get better.
You couldn't survive in an emergency department without teamwork, because the patients who come in very sick, one nurse cannot do all the work. If you didn't have teamwork, you'd fail.
I am proud. Every day is pretty satisfying. You know, I always say that every day is challenging. It's never boring. I've never had a boring day at the job. And it makes me feel good that not only I am contributing, but I'm grateful to everybody that I work with.
Typically, when I end my day, by getting ready for the next day. And you know, I know what we have to look forward to, or what's, you know, the downfalls for the next day. And you know, on a typical day, I go home and I'm happy with the job that we've done, and I'm happy with, you know, coming into work the next day, and that's important. I've never had a job where I've looked forward to coming back to work, but here I truly do.
At the end of the day, you know, it's either been a great day of good news and great results for patients, or it's been a sad day of, you know, malignant results and patients that have had their life turned around. But with me being able to talk to them and be there, I hope that, you know, having someone to talk with and to go through that process can help them take their next step. I leave sometimes, you know, with a heavy heart, but other days it's a good feeling to know that I can be there for them.